everyone, my name is Ariel, and today I want to introduce the person I admired in the Time 100 list. Okay, this is my outline. First, I will introduce who is Ophelia Duff and why I want to choose her. Second, in main discussion, I will tell you what Ophelia has done to improve the healthcare system and her organization, PIH. In the third part, we will make a conclusion, and finally, we will have a Q&A session. Do you ever think seeing a doctor is a tough thing to do for us living in Taiwan, especially in Taipei? I think it is very easy, right? But in Haiti, it is a whole different story, and Ophelia Duff played an important role to improve the healthcare systems in those poverty countries, especially in Haiti. That is the reason why I choose her. And in the coming time, I will introduce you what Ophelia has done, her impacts and contributions. First off, let me introduce you who is Ophelia Duff. In addition to being a representative figure in Time 100 list, she also received the Radcliffe Medal and the Hilton Humanitarian Prize. She is a British American. Before she was born, her sister died of measles, so she felt very sadness and desired to help those people like her sister. That is the reason she will build the organization's PIH. And in 1983, at her age of 18, most of people are enjoying themselves at that time, but she decided to be the volunteer in the small eye clinic in the poverty Central Highlands in Haiti. And there she met her future partners who built PIH. We will introduce this organization later with her. And they all witnessed their lack of medical resources at those underserved areas. So she decided to change this unequal medical resource landscape. Once she said, a person's lack of access to health care is caused by failures of human-built systems, and because these systems are built by humans, they can be fixed by humans. And she had worked tirelessly toward that since ever. Okay, next up, let me introduce you Ophelia Duff and her organization, Partners in Health. We often call it PIH. This is a non-profit medical organization which is found with the goal of prioritizing healthcare of the poor countries, and is operated by setting up the health systems and facilities in those poverty areas. They have served more than 3 million people so far. Currently, there is a documentary called Bending the Arc. This is a movie told a story about this organization and what they provide a service. But in fact, this organization didn't have an easy journey. Most people may think government is an obstacle to those charities, but when the PIH grew up, some people tell Ophelia Duff that if you only relying on the charity, it will not be the sustainable way. So she decided to cooperate with government. As a result, the local clinic clinic can cooperate with the central hospital and the health unit. As she do that, the PIH can grow up more. And they also consider that they don't want the people feel like they are given by the charity, so they hire some people and give them money to train them do some easy tasks to make them feel needed. That is the reason why Ophelia helped this organization be more stronger. Through PIH, Ophelia improved healthcare conditions in many poverty countries. For example, she provided anti-retrieval therapy in AIDS-prone areas, and she treatment and prevention measures for diseases like malaria and tuberculosis in Haiti and those poverty areas. Also in 2014, during the Ebola outbreak, she and her organization went to those hardest hit areas to plan and bolster the local medical resource in like Sierra Leone. And during the COVID-19 pandemic, she went to the Massachusetts working with 351 local departments to prevent the outbreak of COVID-19. Additionally, they also built the Maternal Center of Excellence in those countries with the highest maternal mortality rates. This center's main goal is to helping pregnant women. It provides a lot of service like 24-hour electricity to support C-sections and a blood bank to respond to postpartum hemorrhages, and a fully stocked pharmacy in labor and delivery. At the end, they also provide training for clinicians to improve their skills and provide better care to patients. Lately, they also set up a lot of educational systems to train some healthcare professionals to join their group and that their group can help more people. Okay, this is my conclusion. I really admire Ophelia Gao for choosing to help people in a remote area with those limited medical resource area, and despite to find those qualification and skill for high-paying job. Whether her efforts in preventing and treating infectious disease or her contribution in whole healthcare environment, they are all admirable. At the same time, it also let me know the importance of cherishing the healthcare resource we already have. In the future, if I have the opportunity, I may find those opportunity to join the volunteer program in the PIH and help a lot of people just like her. The first step I will make choose Taiwan because I think our country is the most important place that I need to help. This is my presentation. Thank you. 还没有。